What is breast density, and why does it matter? Breast density is categorized into 4 categories: fatty, scattered tissue, heterogeneously dense, or extremely dense. Dense breasts are composed of more fibrous, connective tissue and glandular tissue, meaning glands that produce milk and tubes that carry it to the nipple, than fatty tissue. Because fibroglandular tissue and breast masses both look white on mammographic images, greater breast density makes it more difficult to detect cancer. Nearly half of all American women are categorized as having dense breasts. Having dense breasts also increases the risk of getting breast cancer, though the reason for this is unknown. Because of this, decisions about breast cancer screening get more complicated. While evidence is clear that regular mammograms save lives, additional testing such as ultrasound, MRI, or contrast-enhanced mammography may be warranted for women with dense breasts. What does the new FDA rule say? The FDA now requires specific language to ensure that all women receive the same accurate, complete, and understandable breast density information. After a mammogram, women must be informed whether their breasts are dense or not dense. That having dense breasts increases the risk of breast cancer. That having dense breasts makes it harder to find breast cancer on mammograms. That for those with dense breasts, additional imaging tests might help find cancer. They must also be advised to discuss their individual situation with their healthcare provider to determine which, if any, additional screening might be indicated. Why did the FDA issue the new rule? Prior to the federal rule, 38 U.S. states required some form of breast density notification. But some states had no notification requirements, and among the others there were many inconsistencies that raised concerns by advocates, including women with dense breasts whose advanced cancer had not been detected on a mammogram. The FDA standardized the information women must receive. It is written at an 8th grade reading level and may address racial and literacy level differences in women's knowledge about breast density and reactions to written notifications. For instance, our research team found disproportionately more confusion and anxiety among women of color, those with low literacy and women for whom English was not their first language. And some women with low literacy reported decreased future intentions to undergo mammographic screening. What is the value of additional screening? Standard mammograms use X-rays to produce two-dimensional images of the breast. A newer type of mammography imaging called tomosynthesis produces 3D images, which find more cancers among women with dense breasts. So, researchers and doctors generally agree that women with dense breasts should undergo tomosynthesis screening when available. There is still limited scientific evidence to guide recommendations for supplemental breast screening beyond standard mammography or tomosynthesis for women with dense breast tissue. Data shows that supplemental screening with ultrasound, MRI, or contrast-enhanced mammography may detect additional cancers, but there are no prospective studies confirming that such additional screening saves more lives. So far, there is no data from randomized clinical trials showing that supplemental breast MRIs, the most often recommended supplemental screening, reduce death from breast cancer. However, more early-stage, but not late-stage, cancers are found with MRIs, which may require less extensive surgery and less chemotherapy. Various professional organizations and experts interpret the available data about supplemental screening differently, arriving at different conclusions and recommendations. An important consideration is the woman's individual level of risk, since emerging evidence suggests that women whose personal risk of developing breast cancer is high are most likely to benefit from supplemental screening. Some organizations have concluded that current evidence is too limited to make a recommendation for supplemental screening, or they do not recommend routine use of supplemental screening for women based solely on breast density. Others recommend additional screening for women with extremely or heterogeneously dense breasts, even when their risk is at the intermediate level. What should women consider about added screening? Because personal risk of breast cancer is a crucial consideration in deciding whether to undergo supplemental screening, women should understand their own risk. The American College of Radiology recommends that all women undergo risk assessment by age 25. Women and their providers can use risk calculators such as Tyrer-Cuzick, which is free and available online. Women should also understand that breast density is only one of several risks for breast cancer, and some of the others can be modified. Engaging in regular physical activity, maintaining a healthy weight, limiting alcohol use.